Hello friends, welcome to the third part of anti-arrhythmic agent. In this, we will see first of all the classification and the different category of drugs which are used as anti-arrhythmic. This is what the classification of anti-arrhythmic agent. Vaughan Williams, these are the founder or we can say a person who classifies these anti-arrhythmic agents which are used. So there are four principal classes: sodium channel blockers, beta blockers, potassium channel blockers, and calcium channel blockers. Sodium channel blockers are also called as membrane stabilizing agents. These are also classified according to their phase 0 depression. Those who are moderate depressants, they are called as a 1A. Those are minimal depressants of the phase 0, they are called as 1B. And those are maximum or marked depressants are called as a 1C. Decrease the depolarizing agent, these are also called as a membrane stabilization agent, also beta blockers like propranolol. And the those drugs which prolong the depolarizations are potassium channel blockers, and the last category is calcium channel blockers. So next to it we will see the sodium channel blockers. So sodium channel blockers from class 1A, these are the moderate phase 0 depressants. Here we can say this is the phase 0, so there is a this depressants, moderately depressant, so the gap in between these two lines will be increased, so this slope of this line will be depressed down. So these are the moderate depressant, so this gap in between these lines will be little bit enhanced, we can say moderate depressant space. So they reduces the upstroke of action potential. So this upstroking of the action potential will be reduced over here. Decreased in automaticity of the all tissues. So whatsoever the automaticity which is present in a cardio conducting system, the cardiovascular system, that will be depressed over here. So triggered activity is also reduced in the slow phase 4. So we know very well that this is a phase 4 of our electrophysiology. So various activity triggers this phase 4, and due to that there is an initiation of an action potential generation. So this is reduced triggering will be observed in the sodium channel blockers, which is from class 1A. So they also reduces the responsiveness and conduction. The tissue does not respond to the stimuli. The responsiveness is reduced. Prolongation of action duration potential. So action duration is potential is prolonged. Therefore, the total duration of this electrophysiological events is prolonged. So prolongation of a refractory period. Again, we can say the refractory period means over here this is prolonged. So slope of this line. So you can say this is length. So this refractory period is prolonged. So it abolishes the re-entry arrhythmia and increase in QRS duration. You can say here QRS duration, here this duration is also increased, and QT interval, this QT interval is also enhanced. So prolongation of QT interval. So these are the main effect of the sodium channel blockers from 1A category drugs, which are including in this quinidine or procainamide, like this category of drugs. Next category is sodium channel blockers from 1B category. So they are the minimal phase 0 depressants. So here again the phase 0. So here is again the widening of this gap is little bit minimal. Previously it is a moderate. Now it is a minimal one. So automaticity is also depressed in Purkinje fiber. The automaticity of the Purkinje fiber, so as to take up the impulse and to amplify it and to propagate it has been decreased. So there is a propagation of impulse will be decreased. So abnormality in triggered activity is also depressed. So abnormally triggered activity, so triggering of this impulse will be depressed. Node depression occurs, and which is also suppression into the sick sinus syndrome. Slope of phase 4 depolarization is depressed. You can see here refractory period or phase flow. So this is also depressed over here. So there is a enhancement in this gap. So increased excitability. This is one of the little bit adverse effect we can say contribute for that. Excitability is little bit increased. There is a moderate reduction in responsiveness. The tissue does not respond to it. So there is a reduction into the responsiveness and conductivity. Action potential duration, there is no change significant observed due to this sodium channel blockers, class 2 1b. Prolongation of a refractory period, that is resting membrane potential remains over there for a longer duration of time. Re-entry arrhythmia is completely blocked. There is no change in the significant changes in the automaticity or ECG is observed. So this is about the sodium channel blockers from 1B class. Example of the drugs which are in this category as lidocaine and phenytoins. And the last class is from the sodium channel blocker is class 1C. So these are the marked phase 0 depolarization depressant. We have seen in the previous graph also there is a enhancement in the gap. So here there is a marked enhancement in the graph. So it significantly modify the electrophysiological properties of ventricles. So these class 1C drugs act mainly on the ventricles. So therefore they are used in a ventricular arrhythmia. Properly they are used in a ventricular arrhythmia. They suppresses the spontaneous premature ventricular depolarization. So unnecessary, there is a premature generation of the impulse or impulse of the contraction. They are suppressed. So therefore those who are premature impulse contractions, they are suppressed over there, and therefore the arrhythmia will be reduced. So phase 4 action potential generation or overshoot is suppressed. So suppression of those who are immature, they are suppressed. There is suppression in responsiveness and conduction. So unnecessary the responsiveness towards the small stimuli, they are suppressed. So therefore unnecessary contractions and conductions of the impulse has not taken place. So overall there is a depression of the ventricular muscles. There is a prolongation of AV nodal refractory period. AV nodal refractory period is means the atrioventricular node picking up the signal and transporting to the Purkinje fiber. So there is a prolongation of that period, means refractory period is prolonged, means there is a little bit of resting period is a little bit over there. So it takes a little higher time to propagate that impulse from AV node to the Purkinje fibers. So here there is a, and therefore the heart is having little bit of resting type of phenomena. In between it rests for some for a minute, for a while. And due to this we can see here there is a prolongation of a PR interval. You can see this one, PR interval is prolonged, and also QRS duration is also increased. So you can see this one, this is also increased in ECG. So this is what about due to prolongation of AV nodal refractory increase, prolongation of PR interval and QRS intervals. So mainly these are the drugs which are given orally and used specifically in the ventricular arrhythmia type of things. So this is all about the sodium channel blockers from 1A, 1B and 1C category. In the next video we will see the remaining category.